Rudolph. I'm a clinical pharmacist. I've worked in both retail and hospital pharmacies, and I've been practicing pharmacy for about 11.5 years, so I've seen quite a bit in that time. And my talk is called Life is Full of Choices. I don't know if any of you saw the newspaper today, but I find it kind of ironic that during Heart Healthy Month here and the holiday of the heart coming up, Valentine's Day, McDonald's is actually taking reservations down in Dale Mabry so you can make your own memories. How much more American does it get than that? So, I won't be talking about that. I'll be talking about a whole different way to approach heart health here. And I'll just start off with some statistics that a lot of you have seen before. About a third of Americans are overweight. About another third or a little bit more are obese. And almost just under 20% of children are actually overweight or obese now. So that's scary. You can see a lot of type 2 diabetes, which is adult onset, now occurring in children. Chronic diseases affect are responsible for 70% of all the deaths in the U.S., and 50% of Americans have at least one chronic disease. So if you look around, every other person in this room has at least one chronic disease or more. And as far as the number one killers, obviously, is heart disease, cardiovascular disease, heart attacks, strokes. That accounts for 50% of all deaths, and then cancer is number 2. You combine those all together, it's 50% of people die from those causes. And those are largely preventable and even reversible in some cases. So there's a lot you can do with your lifestyle to change your outcome with those diseases, which is really good news because you're in control. Arthritis is the most common cause of disability, and diabetes is the leading cause of kidney failure, non-traumatic limb amputations, and blindness in America. Now in America here, we think that the cause and the cure of these chronic diseases is a drug shortage in the blood supply. So that's how we kind of approach things. But unfortunately, that's not the case, because we've never had more drugs, more procedures, and more surgeries, and we've never had more chronic disease in the U.S. or around the world. So obviously something's not working right here, and we need to kind of look at our approach and change what we're doing if we want better results. In the latest data that I got was in 2011, there were over 4 billion prescriptions sold just in the U.S. And that's about $320 billion spent on prescriptions. So can you imagine what we could do with $320 billion if everybody was healthy and fit? And we can go on vacations every other week, you know? Wouldn't that be great? That equates to 12.9 prescriptions for every man, woman, and child walking across the U.S. And that's per year. 12.9 prescriptions for every person in the U.S. per year is dispensed. It's about $1,000, a little bit over $1,000 per person. And just to let you know what that looks like, I brought a bag of pills here. This is 13 prescriptions. So every man, woman, and child gets almost 13 prescriptions per year dispensed in the United States. That's a lot, especially when you include little kids in there too, because you know they're not taking a lot, and healthy people don't take any. So sick people are the ones that take drugs, and healthy people don't take drugs. So definitely the road to health is not through prescription medications. If at all possible, you could get much better results with lifestyle changes. So, but we have a pill for everything, right? You want to see better, eat better, bleed better, breathe better, pee better, and even poop better. And there's a whole line of laxatives out there on the shelves in the grocery stores and in pharmacies for you to choose from. But really, these, again, are not addressing the cause of the disease. They're only addressing the symptoms. So we're trying to treat symptoms. We're not trying to treat causes. And that's why people stay sick. So there's 4 common causes of chronic disease. It's not a drug shortage. There's poor nutrition, lack of physical activity or exercise, tobacco use, and then excessive alcohol consumption. And those are all 4 modifiable risk factors that each and every one of you has control over, which is great news because, again, you can affect the outcome of your own health. And then I'm going to target in on heart disease here since this is Heart Healthy Month. And the #1 primary reason that we have heart disease is because of atherosclerosis. That's the cause of heart disease. So what happens is with atherosclerosis, you have high cholesterol. Everybody's heard of high cholesterol. And of course the statin drugs that are used to bring your cholesterol down. Atherosclerosis is just a cholesterol plaque buildup with a bunch of other toxins and chemicals in there that shouldn't be there in the wall of your artery. And that's what causes the majority of heart attacks and strokes and chest pain and angina and everything that you can think of when it comes to cardiovascular disease. And it's due to the high consumption of animal fats, saturated fats, and trans fats found in the Western diets. And that's basically comes from animal-based and processed foods. So what happens is these fatty streaks actually start occurring when you're a kid if you're on the typical Western high-fat diet. And about in your teens or even around 10 or so, you get these little fatty streaks that line your blood vessels or your coronary arteries or your arteries and blood vessels all around your body actually. And then in your 20s and 30s, it kind of grows into a premature plaque, a fibrous plaque, and you're still feeling good, you don't feel like anything's wrong, but really there's a storm brewing inside of you. So you can start making changes at any time in life, and you can actually halt or even reverse this outcome whenever you start. Just like with exercise, and the guys were saying that you could start an exercise routine at any time in life, you can start eating well and exercising and change the outcome of this. So by the time you get to your 40s and 50s, now you've got those calcifications in your heart, and they really start to block that. You can see it's really starting to block almost more than half the vessel. So when you get into your later years, 50s, 60s, and 70s, that's when the chest pain comes, that's when the heart attacks come, that's when the strokes come. And the cardiovascular system is not just a disease of the heart. Your blood vessels and arteries and veins and capillaries, they go all throughout your body. So cardiovascular disease is actually a disease of the whole circulatory system. So it doesn't just affect your heart. An infarct is called a heart attack, and then obviously stroke. But you can get gangrene. That's poor. That's a lack of circulation to your extremities. And a lot of times diabetics will get this because they also have cardiovascular disease. And eventually, if you're not getting oxygen and nutrients to your tissues and you get infections, then you can't repair those infections, and gangrene happens. And then, unfortunately, I see a lot of times where diabetics will come in and will have to chop their foot off or chop their toe off or even their whole leg because they've got a gangrenous infection and it's completely black and necrotic and you can't save it. So that's definitely not where you want to be. And then there's also aneurysms too that can happen. One of the leading experts in cardiology is Dr. William Roberts. He's a cardiac pathologist at Baylor University Medical Center. Cardiac pathologist is actually a specialist is what I refer to it as, because cardiologists and cardiac surgeons and interventional cardiologists, the ones who you would typically go to if you are referred to from your family doctor, they're the ones you normally see for your heart problems or your cardiovascular problems. But a cardiac pathologist actually takes those hearts from those deceased people that died of heart disease, from those cardiac surgeons and whatnot, and they'll send the actual heart to the cardiac pathologist, and they're kind of like the detective, the homicide detective or whatnot. And they're looking, why exactly did this heart stop functioning, and where did it happen, and what are all the details? So they're really the specialist. So nobody knows heart health better than the cardiac pathologist. And Dr. William Roberts explains it very well. He goes, symptomatic and fatal atherosclerosis is extremely rare in societies where serum total cholesterol levels are less than 150 and serum LDL levels, which is your bad cholesterol, is less than 100. Hypercholesterolemia is the only direct atherosclerotic risk factor. The others are indirect. If, however, the total cholesterol is less than 150 and the LDL is less than 100, the other risk factors clearly accelerate atherosclerosis. Now, what he means by that is, you've all heard that smoking is a risk factor for heart disease. Family history is a risk factor for heart disease. You know, lack of physical activity, and on and on and on. But those are all secondary risk factors. So if you control the primary risk factor, which is high cholesterol, and you get your numbers to your total cholesterol below 150 and your bad cholesterol below 100, those other risk factors don't play a part in it. Now that might seem kind of odd, but Dr. Caldwell-Esselstyn has actually talked about this. He did the study to prevent and reverse heart disease through nutrition. And he talks about the Tarahumara Indians that actually are a very primitive society, and they live mostly on a whole foods, plant-based lifestyle and diet. And they are extremely active, very, very active. And they smoke like chimneys, but there's absolutely no heart disease, none whatsoever, because their cholesterol levels are all below 150. So your cholesterol is really what you should be targeting if you want to prevent or even halt or reverse heart disease. So what about the drugs? I'm going to talk about a couple of different review studies here, and these were done by the NNT. It's the numbers needed to treat. It's a group of physicians up in New York, and most of them are in New York. They got together and they were kind of frustrated and disappointed in how a lot of the studies were being reported, because when you go on the news it says, oh, this drug will reduce your heart disease or your cholesterol by this much percent or what have you. And unfortunately, the way stuff gets reported to the public and to even medical professionals is that it's in terms of relative risk reduction. And the drug companies will use that term, and they'll report stuff as, you know, Lipitor reduced your cholesterol by such and such a percent. And usually it's a pretty good percent, you know, 30, 40, 50%, something like that. Well, that's relative risk reduction. That's not absolute risk reduction. So the difference is, relative risk reduction is you take 100 people in one group and 100 people in another group, and let's say you follow them for a period of time, and you give one group the statin drug, and you give the other group no drug. And then you see how many people had heart attacks or strokes or whatever you're measuring over that same period of time. And let's say 4 people had a heart attack in the group that didn't get any drugs, and 2 people had a heart attack in the group that got drugs. So obviously the drugs reduced the amount of heart attacks from 4 to 2, right? But you got 100 people in each group. So what the drug companies love to do is they'll go, if you take our drug, it reduces your heart attack risk by 50%. Now, is that really 50%? No. You reduce it from 4 people to 2 people. So it's 2%. So it's a 2% absolute risk reduction. So that's really what you want to key in on, is what is the absolute risk reduction. And fortunately, the NNT, this group of physicians, you can see here, it's the NNT.com. You can go on there, they have tons of information and reviews, and they dig through all the scientific literature, and they actually very tediously go through all the studies and look for the absolute risk reduction number in terms of the numbers in the report, not just for heart health, but all kinds of stuff. And what they did is they looked at statin drugs for primary prevention, which means that in patients who have never had heart disease, never had a heart attack, no chest pain, no strokes, no nothing, and healthy patients. And if you give these people statins, how well do they work? And here's what they found: 98% saw no benefit. No lives were saved. 0% lives were saved. There was a little bit of a benefit in reducing heart attack and stroke, about 1.6 and 0.4%. And 2% were harmed by diabetes. They actually got diabetes because of the statin. And 10% had some sort of muscle weakness or pain from the statins. And a lot of people have heard the statins are rough on the muscles, and that usually causes a lot of people to discontinue those drugs because of that. So as you can see, it's a whole different story than what's going to get reported in the even the medical journals or on the news. But this is the absolute truth, and this is the actual numbers that you need to look for, so that you can understand what you're getting into if you're going to take a drug or not take a drug.
Dustin?
The other thing I forgot to mention there, go ahead.
That appears to be fraud.
That's a good way to put it. Yes, that's a good way to put it. It's misleading. It's very, very, very misleading.
Yeah, misleading fraud that's harmful to the people that they're selling this stuff to.
I agree, and it takes people who are willing to stand up and tell the truth to the general public and to even medical professionals, so that they understand what they're looking at. And I thought I knew what I was looking at when I was looking at studies. As I got through pharmacy school and got out and on my own practicing, but I learned so much more that it's not just about taking it for granted what the authors of the study say. You actually have to go in there and look and dig for this stuff, or find a group like the NNT or the Cochrane Reviews is another one, where they actually go and they do all this tedious work to report the numbers accurately.
I understand it hurts your liver too.
What's that?
I understand it hurts your liver too. It hurts your liver too.
Oh yes, there is a possible chance of liver dysfunction, and that's why both before and then during the course of treatment of statins, the doctor will have liver enzymes done. That is true. So in primary prevention in healthy people who have never had any cardiovascular events, the NNT voted or recommended that to not use statin drugs as a means of primary prevention. That's why you got the red light there. The next, we're going to look at secondary prevention. This means in people who have had a heart attack, they've had a stroke, they've had some kind of hospitalization for a cardiac event. So what about them? If you put these people on a statin, what does it look like? And what they found is it's a little bit more helpful. Not much, but 96% saw no benefit. But there was one life out of every 83 people who took the statin that was saved. 2.6% and 0.8% were helped by preventing a heart attack or a stroke. And then, of course, you had the same side effects with that. 2% with diabetes, 10% with muscle weakness and pain. So the recommendation was that the benefits outweigh the risk, and therefore it is recommended to take a statin. But that's the recommendations just on the benefits versus the risk. You as an individual have to decide, looking at these numbers and these facts, whether it's worth it to you or not. Because that's what it matters to you. I mean, you're the one living your life. You're the one getting out of bed every day. So as far as diet goes, this is a whole other way to approach cardiovascular disease. And this is really exciting because this works far better and there's no side effects. There's 3 studies that I want to point out. Dr. Dean Ornish over in California did a study. Dr. Caldwell Esselstyn up at the Cleveland Clinic did a study. And then in Dr. Ornish's study, he compared his diet to the American Heart Association's diet. And what these consisted of was Dr. Ornish had a plant-based diet, whole foods plant-based diet, fruits, vegetables, whole grains, legumes. So he did include a little bit of non-fat dairy and alcohol. But he avoided all meats, simple refined sugars, and avoided all vegetable oils, even olive oil. And there were no statin drugs or lipid drugs given to this group of participants. The Esselstyn diet was less than 10% fat, and Ornish was about 10% fat. But it was a whole foods plant-based diet. It was fruits, vegetables, legumes, whole grains. And he did start out the study with a little bit of skim milk and some non-fat yogurt. But when he learned about the link between dairy and some other chronic diseases, he removed the dairy from the participants' meals as he went along. So most of the study was done without that. He did use lipid-lowering drugs only in patients who couldn't get their total cholesterol over or less than 150. That magic number of 150 is where heart attacks basically cease to exist. And that's where he would interject with the very, very lowest dose that he could of the statin drug. And then the American Heart Association diet that went head-to-head with Dr. Ornish's just says, don't worry about what you eat, just limit your fat intake to 25%, and then we'll give you some drugs. So how did they work? And I made this nice little chart here. You can see at baseline what their cholesterol levels were, and they were all typical American cholesterol levels, well over 200 or even close to 250. And they measured all the results at the 5-year mark. And that's what's nice is all these studies, we have 5-year data so we can compare apples to apples. So at the 5-year mark, the cholesterols, look how far they went down. Ornish's went down to 188. The average cholesterol in Esselstyn's group was 132, so he got below that 150. And then the American Heart Association diet, it went down, but it was still in 217. It was still really high. Now, the percent of patients who halted their progression of their heart disease in the studies, Ornish and Esselstyn fared very, very well. They both had 100% of their patients completely stop heart disease right where it was. The American Heart Association diet, which is supposed to be heart healthy, right? They actually saw no halt or reversal of heart disease, and they saw a 27.7% worsening of the coronary blockages in the coronary arteries, and they found that out because they actually did angiograms on these people, and they looked at their coronary arteries to see where the blockages were before and after, and they found almost a fourth, 27.7% progression, worsening of it with the American Heart Association diet. As far as patients reversing the disease, 68% in Ornish's group and 73% in Esselstyn. And you can see just the little details between Ornish and Esselstyn. Esselstyn got a little bit better results, and he also used the low-dose statin in people who couldn't get below 150. So the details are what make a huge difference when you're doing these nutritional changes. And then as far as number of cardiac events during the 5-year study, Ornish had 25, and cardiac events means like heart attack, chest pain, hospitalizations, that kind of stuff. So Ornish had 25 events in his group. Again, Esselstyn had 0. He had the best results, but he was a little bit stricter and a little bit more in tune to some more of the details. And the American Heart Association had 45, almost double what Esselstyn did, and that's a huge, huge difference. Now, why don't people know about this? Why does the media always talk about the American Heart Association and go on a heart-healthy diet, and then we do what the American Heart Association does, and we do the heart-healthy diet, and then everybody stays sick and medicated? Why is that?
Money.
And the reason is money. The reason is the pharmaceutical companies. They give millions of dollars a year to the American Heart Association and other organizations, like the American Diabetes Association, American Cancer Society. And that affects the information that is given or is able to be released to the public. And I went back and I actually went through all the financial statements of the American Heart Association for 2009 and 2010. And I dug through and I saw, and I added all up, how much are the pharmaceutical companies and medical device companies and these insurance companies giving to the American Heart Association. And I found out that it was a little bit over $25 million in that 2-year period. Now for that same year period, 2-year period, I went and I looked how many statins are sold in the US, and or how many other cholesterol meds, mostly it's statins. But $33 billion in statins were sold in that same period of time. So you can see where, I mean, $25 million is a lot of money to us, but to them it's nothing, because they're making billions. So here's some of the individual contributions to the American Heart Association. You can see the different drug companies and then the drugs that they sell in there. But it's, 3, 2 million, 5 million. There's a lot of money involved in this.
Dustin, what were the lower numbers? 3.5
These
million?
ones?
Yeah, what do those dollars represent?
These companies right here, you know, they donated $3.5 million to the American Heart Association.
That's chicken feed for those people.
It is. And these are the drugs that they, Plavix, Coumadin, Lovenox, Pravachol, Avipel, between those. You know, Lipitor, Norvasc, Pfizer makes that, they gave $2.3 million. Shearing Plow and Merck, you know, you all heard probably of Zocor, maybe Zetia, they gave over $5 million. Novartis makes Lexicol and Diovan, they gave $2.4 million. So, I mean, it's a drop in the bucket to them, but it sure does pan out pretty well in the end, because the message that the general public gets is not what they need to hear if they're wishing to halt or reverse heart disease.
And that went to the heart disease, American Heart.
The American Heart Association.
Where were those dollars spent? Where were those $25 million spent? Do you know?
Probably on advertising.
They have a number of different.
How much of that $25 million went to the payroll of the American Heart Association?
I don't know the
That's the
details.
question.
The people running it.
I don't know the details of where they allocated all the money, but I think the main point to get here is that millions of dollars are being given by these for-profit companies who want to sell a product to you to increase your heart health, and the message that's getting out is keeping people sick. And so it's really important to understand this, because once you get it, you can narrow in on what to look for. And you know, I thought the American Heart Association was the go-to organization for heart health, and that's what we were taught in school. But obviously they're not. You know, their own study shows with their diet that it progresses heart disease. And so there's a lot of variety that you can do, and very delicious food that you can make and can still be healthy, and you can still take on a lot of these diseases. So I have more information. If you want more information on my website, it's Pursue a Healthy You. And you know, the reason that I get up and I talk to people like this, and I have so much information on my website, which is all free, is because I care. And I got into healthcare because I care about people, and I want to help them with their health. And so to do that, I've noticed that I've had to change the way that the information that I give to people, because if I just talk about drugs and you know, statins for cholesterol and acid and PPIs for acid reflux and all this stuff, people just stay sick and medicated for the rest of their life. And I don't want people to stay sick and medicated for the rest of their life. I want people to get well. So I tell people the truth based on the science and what actually works. Really, the only thing that matters to me is results. And I tell people all the time that I'm a healthcare professional, and professionals are the best at what they do. And my job is to care and to produce health. So if I'm not doing those two things, I'm not doing my job. So it might be some things that people haven't heard or don't want to hear, especially within the healthcare industry, because it's so profit-driven. But my main objective is to help people live in health, not to get rich. And that's why I give you all this information.